Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. And as you know, the show is dedicated to safe and effective natural ways of helping to either prevent, treat, and possibly even overcome, cure even serious medical problems, diseases, and conditions. Today, we're going to be talking about diabetes. I thought I did a show on this before. Apparently, I didn't. Let's get right to it because we try to do all this very fast and easy. You all know what diabetes is if you're listening to this show. It's a chronic disease. It occurs when your blood sugar levels are either too low or too high, mostly too high, either because your body doesn't produce enough what's called insulin or because your cells don't respond properly to insulin. Insulin is produced in the beta cells of the aisles of Langerhans in your pancreas, and some people just don't have a healthy pancreas. And there's reasons why, and we're going to talk about what you can do for all this presently. And it can lead to many different health problems. Particularly, it weakens the immune system and it damages the microcirculation, literally to all your organs, your skin. It affects your nervous system and the nerves to the skin. And this becomes very serious. You all know in just giving you a brief thing on this, there's type 1, which is an autoimmune dysfunction. You can be born with it, develop it early on in life or even later in life. And that's where these insulin-producing cells are just destroyed. And then there's type 2, which is insulin resistance, or you're just not making enough insulin anymore. And this could be causing you to become obese. It could be due to inactivity, or obesity can help cause it. Sometimes it's genetic. They believe, it's familial. There's a gestational form of this, so moms can give it to their children when they're born due to hormonal changes that happen during pregnancy. I'm not going to go into the testing, the A1C. If you're concerned, see your even traditional medical doctor because they're good at diagnosing this. Functional medicine is better to treat it. Okay. It leads to cardiovascular disease, heart attacks, strokes, various heart problems, kidney damage, kidney disease. Biggie is the nerve damage. We can get pain, tingling, numbness. You can get digestive diseases. And with by the way, with the neurologic, the pain, the tingling, the numbness, it breaks down skin. So you can wind up getting diabetic ulcers, particularly on your feet. And that can lead to gangrene. And this I see an awful lot. If you want, listen to my show on wound care, and you'll be able to learn how we treat wound care, particularly in diabetics. Amazingly effective. It's at saving toes and feet and legs from having to be amputated. So lots of foot problems related to this. It can cause eye damage. Cataracts develop more readily, glaucoma. It can lead to diabetic retinopathy, which can lead you to go blind. It can affect your brain. It has many, many, many different effects on your life. The main method we use to treat it is intravenous ozone therapy. Intravenous ozone therapy cleanses, detoxifies, it boosts your immune system. It opens up the microcirculation and can repair, because it stimulates natural stem cells, it stimulates your body to make the cells that can repair anything in your body, particularly in the direct IV method, as well as the 10-pass method, two of the main methods we use. Not all ozone therapy is created equal. And while people say I do it, it's like, well, what if you took the wrong antibiotic? It ain't going to work. And if you're trying to build a house and all you have is a two-seater sports car, you're not going to be able to transport building materials. You need a pickup truck or something to bring them. So you have to have the right vehicle, the right method. Now, if you listen to my show called Intravenous Ozone Therapy, Everything You Need to Know, it goes over all the different methods and why, what they do and why we use the ones we use. So having said all that, We have seen nothing less than astounding results in the treatment of diabetes, even for people who've had it for years and years and years. Amazing, just amazing and astounding results. Type 2 diabetes, we've even seen reversed, which is pretty amazing. I remember when I got a call in 2014 from a doctor that I had trained in Puerto Rico who said, I just reversed type 2 diabetes. And I go, wow, that's pretty amazing. I haven't done it, and I've been doing this many, many more years than you. That same year, I reversed type 2 diabetes in a patient who I was treating for Rocky Mountain spotted fever, no less. And just unbelievable. And since then, we've seen more. Now, we can reverse the adverse effects, particularly if you're, and it's a 2 to 6 minute treatment. You have to do it at least 3 or 4 times a week. More might be better. Patients that could come in more often, but at least 3 or 4 treatments a week is essential. You're never going to fix it if you don't get your sugar in control. That's the number one thing I tell all the patients. So you have to be testing yourself. When I ask people, how often do you test yourself? Oh, once, twice a day, sometimes. Okay. You need to be testing yourself 5, 6 times a day. All right, I know, listen, you don't want to get rid of this. You'd rather live with it. It's okay by me. If you really want to get rid of it, if you really want to get rid of all the worst effects of it, you're going to have to do what it's going to take to do. So you can get these new devices that you plug into your skin, in your arm or your leg, different devices that attach to an app on your phone. You hold your phone there and it tells you what your sugar level is. And it's darn close enough to matter so you don't have to keep sticking yourself all the time. Okay? And now you need to test yourself when you wake up in the morning, after breakfast, ideally mid-morning, after lunch, mid-afternoon, after dinner, and bedtime. Those are the ideal times to be testing yourself. And you have to get your sugar in control. I don't care what it takes. If it takes insulin, it takes insulin. On the other hand, most people, particularly with type 2, can get their sugar in control just by diet and exercise. You need to do aerobic exercise, maybe 20 to 30 minutes a day. Walking, swimming, ideal, biking. Those are the simple. It doesn't have to be heavy duty, but you have to be watching your diet. You don't want to eat any simple carbohydrates, flours, breads, things like that. You want to eat complex carbs. You want to eat all natural organic foods. You want to stay away from any form of sugar. I don't care if it seems, natural, like honey. If you need sweet, there's other natural, safe sweeteners like stevia that you could use, or xylitol, my favorite, that you can use as a substitute. And you never have to eat real sugar again. If you're going to mess around, it's going to hurt your life. Diabetes falls into the category of diseases and conditions that may not kill you, but will make you wish you were dead. And we've had nothing but astounding, amazing results in eliminating it and all the worst effects of it from the body. No moral and ethical doctor should ever promise and guarantee a result, but the fact is, we've seen nothing less than just amazing, amazing results in treating it. You want to eat organic vegetables and small amounts of fruit. I say stick to the organic berries because they're very low in natural sugar. Stay away from fruits that are high in natural sugar. That's not healthy for a diabetic diet. Raw vegetables are the ideal way to go. Being on a raw food diet is a wonderful way. You can lightly steam vegetables as well, or stir fry them with just a little bit of the organic S oils or olive oils. Any of the S oils are usually good to use. So you want to eat foods, you see the vegetables that are raw, particularly, they're high in fiber and they can pull extra sugar out of your body. Now, everybody that has this has to know there is a condition. So intravenous ozone 3 to 4 times a week. That's the base of the care. Next is the biome. The gut connects to diabetes. It's called the gut diabetes axis. The gut bacteria communicate with your pancreas. The gut diabetes axis. If you go to our National Library of Medicine, pubmed.gov, and type in search gut diabetes axis, you're going to see there's not one or two, but there's dozens of papers written on it and how the gut communicates with this. So you have to get a healthy gut. The way to get a healthy gut, unfortunately, is not with typical probiotics. Probiotics in capsule, powder, and tablet form are destroyed over 90% in the stomach. You need a living probiotic that is living in a organic juice as a media for it to grow in. And that's where all my patients take Doctor's Biome. DoctorsBiome.com, doctorsbiome.com. Sounds like biome, but it's pronounced biome. And when you get there, I urge all diabetics for the first 2 to 3 months to go on the medical food version of it. The medical food version is just a more powerful version, and it's delicious. It's in a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So it's absolutely delicious. Babies love it. Children who are diabetics love it. They just don't take as much. It comes in these 2-ounce shots. So depending on how old the child is, you may want to actually contact me, and I can give you an idea based on their age and weight, how much to give them. They only take a fraction of that 2-ounce bottle. Anybody else that's 75 pounds or more can do a full 2-ounce shot every day. And you want to do this for a few months, and to get your bowel balanced again and get that healthy communication between your gut and your pancreas to kickstart it and get it hopefully to start working correctly again. It is possible along with the ozone therapy. In fact, don't even wait to do ozone therapy. Start doing that. In addition, you have to be well hydrated, and I urge that you take vitamin C 5 or 6 times a day because it stimulates all the healthy processes in all the healthy cells of your body to work correctly. So you absolutely have to do vitamin C. Here's the catch: 5 or 6 times a day. Now, if you're awake 12 hours a day, that's easy then, because you have 12 hours to do 5 or 6 doses every couple of hours while you're awake, stopping a couple of hours, of course, at least before bedtime, because you need your sleep. So you absolutely want to do vitamin C 5 or 6 times a day, stay well hydrated, do Doctor's Biome, and do intravenous ozone therapy in the methods that we talked about. And this is a way to overcome the diabetic problems that you may already be seriously suffering from, as well as a way to prevent them from happening if you happen to be a pre-diabetic. If you happen to be suffering from hypoglycemia, not hyper, which is diabetes, hypoglycemia, low blood sugar, they often call you a pre-diabetic. And this is the way to get over being a pre-diabetic and get your body healthy again. There's various supplements that are very beneficial in the treatment of diabetes. B vitamins in general, B1, B6, B12 by injection using methylcobalamin or hydroxycobalamin. Oral vitamin B12 is a complete waste of money. It's totally destroyed. As capsule, powder, and tablet probiotics are completely destroyed in the stomach. Doctor's Biome is created to survive the stomach over 90% and then stick to the wall of the gut because it's created with living next generation smart probiotics. There's actually stuff that's called that. They didn't go to Harvard, that stick to the wall of the gut to do what's needed to be done. Vitamin D3, along with K2, vitamin E, chromium, magnesium, zinc, are all important. Alpha-lipoic acid, coenzyme Q10, DHEA, quercetin, aloe, bourbon, a bit of melon can be beneficial in treating it. Cinnamon, curcumin, garlic, green tea extract, ginseng are all highly beneficial in the treatment and in even the prevention if you're pre-diabetic diabetes. Now, you add all those things on that you can add on. But the key is you got to get your sugar in control, and you do it through diet. No excuses. There's no vacations. If you're going to eat something once in a blue moon because it's a birthday party, okay. None of us are perfect. It's perfectly fine, but you can't be doing it regularly. It'll affect your body in a negative way. If you don't have this as a problem, do as you do what you can, do what you like. But if you do, don't mess around with it. Now, if you have any questions, oh, by the way, I'm always told to say this, subscribe to this channel, please. I would greatly appreciate it. Look at all the other shows we've done. You may see many shows that are beneficial to you or a friend or a family member that has other medical problems. Recommend it to your friends. Please subscribe. If you have questions about all this, you're welcome to call my Manhattan office at 212-581-0101. That's 212-581-0101. Or email me a question at Ozone Doctor, OZONEDOCTOR at yahoo.com, YAHOO.com. Ozone Doctor, all spelled out, no abbreviations, at yahoo.com. And I'll be happy to answer your questions and help you out in any way that I can. Everybody, stay safe, stay healthy, stay well, and thank you for listening to me and taking time out of your day to let me come into your life and try and help you in a safe and effective way. Bye now.